and it's still unknown what the long-term effects of the Omicron surge are going to be on healthcare.
That's right. For the short term, prognosis is bleak. COVID cases are once again slamming rural medical facilities, leaving many with stretched resources for treating severely ill patients. Our Stephanie Poole joins us in the studio tonight with more on that story. Stephanie.
That's right. People are becoming infected at staggering rates, and the availability of critical care is narrowing. Now, healthcare professionals tell me with the growing number of ICU patients and fewer hands to assist, it's becoming more difficult to help every person.
There's just no beds.
The surge in Omicron is causing a surge of patients at area medical centers, and that overflow has more people waiting longer for results, especially here in Winona.
It is more contagious than previous variants, so it's impacting more people all at one time.
Jeffrey Whitfield is the director of nursing at Tyler Holmes Memorial Hospital. Whitfield tells WCBI of the 606 COVID-19 tests administered in just a week, 301 came back positive, meaning 1 in 2 people were infected. But not all of them are being sent home with antibiotics. Some require a hospital stay. As COO Kim Timms explains, there's a challenge finding space for those patients, especially those that need ICU beds.
Our emergency room has had to keep patients longer than normal because we just could not find a bed. You know, the capacity was full everywhere.
Tyler Holmes has 25 beds available, 11 for COVID, 14 for inpatient. But there's a constant rotation of patients. So who do they turn to?
We've had patients go to Meridian, Hattiesburg, New Orleans, Memphis, but that would take up to 2 days to get them there. So our hospital is small and we're not equipped to take care of some of these patients for very long a time, but we've done okay so far.
We've already had this happen. They had put several on ventilators, and it's just hard finding a place where they can take the ventilator patient. Getting a patient transferred that needs like a subspecialty care is very difficult right now due to the shortage of staffing and beds.
It's a route rural medical facilities are relying on just to survive the large intake.
We can maintain the best we can.
Representatives with Tyler Holmes Memorial Hospital say only half of their ICU beds are full at this time. They're also planning to use a trauma area to house patients if needed.